Welcome back. It is a virus that hits the very young and the very old, with some 2 million patients affected every year. We're talking about RSV. Pediatrician Dr. Cyrus is joining us this morning with details before we actually head into RSV season. Good morning, Dr. Cyrus. Thanks for being here.
Thank you for having me.
Well, I was going to let you say respiratory syncytial virus, but I think I got it out okay. What is that?
It is a virus much like the flu or COVID that can affect all ages, and it's spread by droplets, aerosol droplets. And so it's something that we see every year, starts in around October, goes all the way through April.
And it can be dangerous, especially for those vulnerable populations?
Can be very dangerous. The older population, 65 years of age and older, and then the younger population, 2 years of age and younger, especially those that are 6 months and younger, and the premature children that are born before their time.
A lot of people right now have heard about the RSV vaccine. It's been advertised. I've noticed it on television as of late, not only for babies, but also for senior citizens. Share with us about this vaccine and how it's going to impact RSV and the season that's coming up.
Well, this is a real game changer. There's actually two different vaccines. One is for older adults, and the other one is for the children 2 years of age and younger. And it's the perfect timing right now, because the RSV season is coming up upon us, but we're not into the RSV season as of yet. Usually it's around October. I mean, this globally, RSV globally is the second leading cause of death, secondary to malaria. So it's a very important virus to combat, just like I said, influenza or COVID.
If a child or a senior develops RSV, let's talk a little bit about some of the symptoms. And we'll put that on the full screen so people can kind of get a better idea of what they can expect. There are some similarities to the cold, and so it's a little bit of a trick to decide, do I need to seek help?
Well, that's exactly right. For the most part, RSV is kind of a mild cold and can be taken care of just with symptomatic care. But in the younger children, they don't have, because it actually can settle into the chest, and it actually affects the ability for us to get things out of our lungs when we cough things and such. And of course, the children are have typically kind of a weakened immune system, much like the elderly population, and so that can be a real factor in how severe the illness can get. So if you are wheezing or a lot of coughing, difficulty feeding with the children, obviously can't really keep the food down because of the cough, then that's something that you really need to seek medical attention for. If it's you can get into your primary care doctor, then do that. If not, seek emergency care.
Yeah, and you mentioned that a lot of the medication over the counter can help some of those symptoms, but if it is more severe, the wheezing, the breathing treatment, steroid, having to go to the hospital, those are the more dramatic instances in this case.
Exactly, because it affects the lungs, it can have people have low oxygen levels in their system. Obviously, it's very difficult, and it can cause confusion in the elderly. And so if you obviously need oxygen, we need to be able to give that to you through a medical facility. And breathing treatments, sometimes steroids are also used. Sometimes we can send the patient home with the medical equipment and the medicine for them to use at home if it's kind of a not completely serious enough to put them in the hospital, but they do need treatment. But then sometimes they may need a chest x-ray and further treatments in the hospital.
So as parents are watching this now, grandparents are watching this, what's your recommendation?
Well, like I said, this is a game changer to be able to vaccinate against RSV, one of the leading causes of hospitalization, especially during the wintertime. I would highly recommend, if you have a child that is under 1 year of age coming into the RSV season, get the child vaccinated. We'll be carrying it, and of course, in our office as an elderly population that I don't see, but I have my mother. I would highly recommend that she get it through her family physician.
All right, Dr. Cyrus, as always, we appreciate you being here. We look forward to seeing you again next month.